To measure a client's flexibility, there are multiple tests you can use. For example, you can use a standard sit and reach test, the YMCA sit and reach test, the chair sit and reach test, the Thomas test, and the straight leg raise test. In order to perform these tests, you'll need the following equipment: a flexometer, which is a sit and reach box, a yoga mat, a yardstick, tape, a chair that is 17 inches high, a ruler in inches, and a goniometer. Before each of these tests, it is important for the client to engage in a warm-up such as light aerobic activities for 5 to 10 minutes. Then for all 5 tests, you will ask the client to remove their shoes. For the standard sit and reach test, you will need the flexometer and the yoga mat. You will place a yoga mat against a wall and place a flexometer on the yoga mat. You will instruct them to sit on the yoga mat with their back against the wall. Then place the flexometer flat against the soles of their feet. Once the flexometer is placed at the 23 centimeter mark, the client will lead with both hands together and exhale as they go forward. Once at the position they go farthest, they must hold that position for 2 seconds and then return to the first position. You will then record the results of how far they reached. You will then ask the client to repeat the test a second time and then use the best score of the two to be classified. Because we use a sit and reach box set at 23 centimeters, this table has the values adjusted so that each value was subtracted by 3 from the 26 centimeter data that was shown on the table. Using the best score from the client's 2 trials, you can then classify them as either being excellent, very good, good, fair, or needs improvement in their range of motion of their trunk. For example, if a 25-year-old male was able to reach 36 centimeters, he would be classified as very good in his trunk forward flexion. For the YMCA sit and reach test, you will need a yoga mat, yardstick, and tape. Place a yoga mat against the wall, and then you will place tape on the 15-inch mark of the yardstick. Once the client is sitting on the yoga mat with their back against the wall and their feet extended, place the yardstick on the mat so that the heels of the client's feet touch the tape. With their heels 10 to 12 inches apart from each other and with both hands together, the client will lead with both hands and exhale as they go forward. Once at the position they go the farthest, they must hold that position for 2 seconds and then return to the first position. You will then record the results of how far they reached. You will then ask the client to repeat the test a second time and then use the best score of the two to be classified. Based on their score, age, and gender, you can then categorize them as being well above average, average, below average, or well below average based on their flexibility of their trunk. For example, if a 22-year-old woman got a result of 22 inches on the YMCA reach test, she will be considered above average. For the chair sit and reach test, you will need the chair and the ruler. This test is ideally used for individuals 65 years or older because it could be difficult for them to get down and off from the floor to perform the sit and reach test. So this test can be used to measure the flexibility of their hamstrings. You will instruct the client to sit at the edge of the chair and extend one leg out with the foot dorsiflexed at a 90-degree angle. The untested leg will be flexed with the foot flat on the floor, keeping the head aligned with the spine and one on top of the other. The client will lead with both hands and exhale as they go forward to try and touch their toes. Once they are at the position that they can go the farthest, they must hold that position for 2 seconds. With the ruler, you will measure how far past they reach beyond their feet or how much distance they still needed to reach their feet in inches. If the client reached their toes exactly, they will receive a 0 score. If they reach past their toes, they will receive a positive score in inches, and if they did not reach their toes, they will receive a negative score in inches. Once you record the results of how far they reached, you will then ask the client to repeat the test a second time, and then use the best score of the two, rounded to the nearest half inch, to be classified. For the Thomas test, which measures the flexibility of the hip flexors, you will need a yoga mat. You will instruct the client to lay supine on the mat and bring their contralateral leg up to their chest. As they are performing this movement, you will look at their leg that is flat on the floor. While they are performing this movement, and if their leg stays flat on the floor, you will classify their hip flexors as being flexible. If their leg rises as they are performing this movement, you will classify their hip flexors as inflexible. Because this client's legs lifted up as they did the test, they will be classified as inflexible. For the straight leg raise test, you will need a yoga mat and a goniometer. This test will measure the flexibility of the client's hip extensors. For this test, you will ask the client to lay supine on the mat. As a tester, you will raise one of the client's legs while making sure the other leg remains flat on the floor. Once the client has reached their full range of motion without the other leg lifting off from the floor, you will measure their angle of flexion with the goniometer. The axis of the goniometer will be placed on the greater truncator. You will then record their angle shown on the goniometer. Flexion of 90 degrees is the desired angle, but a minimum of 80 degrees is acceptable. Anything less than 80 degrees would be considered unacceptable, while anything greater than 80 degrees is considered acceptable. Based on this, you will then classify the range of motion of the hip extensors as either acceptable or unacceptable. Because this client received a measurement of 85 degrees, their flexibility would be considered acceptable. In assessing a client's overall flexibility, all 5 of these tests can be administered to measure the range of motion of the client's different parts of the body.